hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another story, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging.
I don't know what to do. I don't know.
Most intimate.
Okay.
Yeah.
And most rewarding.
Happy birthday.
Hospital
Moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is the secret life of the hospital bed. Last year, there were more than 22 million visits to hospital emergency departments in the UK.
Having high-grade fever and a heart rate of between 120 to 140.
The Royal Victoria Infirmary in Newcastle has more A&E beds than monitoring bays or examination rooms.
Can we get her around?
Hi Rosie, it's just Gemma. Do we have another cubicle around there?
These beds are never empty for long. At busy times, the emergency beds have nowhere to go but the corridors. With all bays full of patients, A&E bed 9 is standing by. It's just before 4 p.m, and today, 27-year-old Sister Hill is in charge of the department's workflow.
In the last hour, I've had about 20 patients book into the emergency department, so we've had an increased volume, so we could call that a surge. We don't get any more staff. It's the same staff we've had all day. I've got no beds on the assessment suite at the moment, which is our admissions unit.
The A&E department is already dealing with a major motorway pile-up. All bays and rooms are occupied by patients. And then another road traffic accident.
Hey, right, Steve. Okay, cheers. Someone's been driving down the A1 and a ladder's fallen off the back of a lorry and hit their car and bounced off.
Sorry, I'm supposed to have a word with you.
A car has been hit by a ladder. It flew off the roof of a van whilst 38-year-old Joanne was travelling at speed.
Onto the red trolley here, please.
Joanne is transferred to A&E bed 9.
You keep your arms nice and still. Okay. One lift. Ready, steady, lift.
Paramedics who were first on the scene assessed the mum of 2.
Remember what I said about your breathing?
Yeah, sorry.
Yeah, it's really important.
She may have damaged her neck and spine. As a precaution, she's been put in a neck brace.
We're in the right place, okay? Be well looked after.
Oh.
Joanne is in shock.
Right, we'll get you booked
Thank
in.
you.
Okay?
Thanks very
You're
much
welcome.
indeed.
I'll go and ring auto glass for you.
Emergency care assistant Buxton, who was first to attend, is a friend.
I heard the voice first and then realised it was Gemma.
When we seen the job came up on the screen and I didn't realise it was her until I seen her dad, and then I looked at the screen and noticed it was Joanne's name.
It's nice to know that somebody's there that you know when you had an accident like that.
Joanne's 66-year-old father Brian was a passenger in the car.
All of a sudden, The ladders just flew off the van and just smashed straight into the windscreen in front of us. So obviously I slammed the brakes on. We're just lucky to be here, put it this way. I was surprised nobody went into the back of the car and caused any more accidents.
Dad Brian was taken straight to see a consultant on arrival. Paramedic Common has news on Joanne's father.
He's all right, don't worry about it. Yeah, he's fine. He's a big, strong man, isn't he?
He is.
He's been very lucky like yourself. He's been examined in the back of the ambulance, but would like an X-ray.
Right, no problem.
But he's happy for him to walk around.
Right, that's all right. And as long as
so don't worry about him.
Can't you just get, like, shocked, don't you?
Definitely. Natural reaction after what's happened. Are you still in pain?
Oh, aye.
How bad out of 10?
I would say it's gone up to 7 now.
It was 7 before.
Was it? I thought it was 6.
An 8.
8.
Would have been a lot worse, but it hasn't.
I've got glass on my face.
Got just like
tiny shards, aren't they?
Joanne's dad Brian has also been given a neck brace ahead of an X-ray.
All right. Sure.
The accident happened less than an hour ago. Brian is also still in shock.
Yeah, you're just driving along and bang. We're here, that's the main thing.
Lucky to be here after
yes.
the ladders.
One guy, I must say, worked for the electric van.
We need to find out who he is.
We need to find out who he is.
There was a gentleman that stopped in an electricity van behind and got Joanne and her dad out and sat them in their van.
And unfortunately I didn't get his name for it. Thank him very much.
Thank you.
Thank you. Thank you very much for what you did. He stopped and he helped and he put Joanne in the van and just looked after her till everybody came. He was really, really good.
Joanne is shown pictures of her car.
I can't believe that, looking at the pictures. I can't believe that I haven't been decapitated for that.
Oh, you're right. That was it. It was the ladders underneath the car that had come off.
A&E Bed 9 will stay with Joanne and her father as they wait for a further examination.
Nice deep breaths, you're going to blow baby out, okay?
Across the UK, around 80 new babies are born every hour.
Baby.
One of the country's largest maternity units is at Queen's Hospital, Romford. The 25 maternity beds here are in high demand. Once a baby is born, they need to be freed up ready for the next expectant mum.
Maternity services are a bit like A&E departments for maternity. You prioritise your triage, we escalate, we have a traffic light system here at Queen's, and basically for any woman that comes in you'll be deemed as low, medium or high risk.
Maternity Bed 7 is moved for its next mum-to-be.
I'm cleaning your room at the moment. As soon as it's nice and clean and done, we're going to transfer you. Okay. So
Yona and Liviu are originally from Romania and are having their first baby. Yona's contractions have started.
Oh, the contraction, too much.
Yona was scheduled to have an elective caesarean section tomorrow because her baby is in the breech position.
Tomorrow, 8 a.m., she have appointment for the caesarean. You know, but...
The water is... She's broken.
She's now the caesarean, not tomorrow, you know. The baby want out.
The baby, the head is
It's
here.
not reverse, his head is up. I tried 2 weeks ago to reverse the baby, but the baby like stay up, you know.
okay, the room is ready.
Working alongside Maternity Bed 7 is midwife Madzikanda.
Breech, it is a complicated delivery. The baby is coming bum first instead of head first. So the head is right at the top of her abdomen, and then the bum is presenting down instead of coming head first. And it will be difficult for the legs to be delivered, so that one they normally opt for a section.
The surgical team and theatres are currently tied up with other emergencies. Until they become free, all Yona can do is wait with maternity bed 7. Newcastle RVI's emergency department is full. Seriously injured patients are being treated following a motorway accident.
So there's a cubicle ready now for her. Right. There's also an additional cubicle if we need it.
A&E bed 9 has been with mum of 2, Joanne, for 45 minutes. She was brought in by ambulance with her dad, Brian. They were involved in an accident on the A1.
3-storey ladder straight through the windscreen. Look, you didn't take a head off.
And they didn't hit the ground, didn't they, no?
No, they didn't hit the ground.
They came straight off.
And I just remember shouting to Joanne, the ladders, and then bang, the windscreen was out.
Joanne's in shock and has pain in her back. She's been given pain relief. Dad Brian is taken to X-ray.
Hey, we need to get around this side.
Okay. Right.
Dad, I'll be here.
Obviously, I went forward and hit my head off the windscreen and whatnot, you know, but luckily I had my arms up when the windscreen came in. I'm more worried about my daughter than what I am about myself. As long as she's all right, that's the main thing. That's all I want. I suppose it's a dad thing.
Joanne and her children live around the corner from her mum and dad. A&E bed 9 is taking her to a monitoring bay. The backboard is taken away.
And I think I've got blood on my new toe. I'm pleased I'm off the board now. I knew it was precautionary for to put us on. I've definitely done something at the bottom of my back. The doctor hasn't examined yet because they're going to give us some more painkillers. I don't know if it's a new injury or if it's pre-existing and it's just exasperated or not. I don't know.
A further examination shows that Joanne's existing back complaint has been aggravated. She's referred for physio and given pain relief. The results of Dad Brian's x-rays are being assessed by consultant Dr. Carroll.
I can't see anything that resembles a break, but he does have long-standing degenerative problems affecting his neck, so that is likely to be aggravated by whatever injury he's had today. So I'll go and have a chat with him. But there's certainly no new injury that we need to do anything active with. Yes. Mr. Short, is that right? I'm Brian, I'm one of the other doctors. Nigel told me about what he found. What you will experience is when you've been in bed overnight, it's all going to seize up. So when you wake up tomorrow morning, it's going to feel as bad as it gets. You're getting regular painkillers. That should loosen up quite a bit. But then the following morning, you're going to be backwards again and you're going to be stiff again. So it's important you keep some painkillers by your bed. So I'll take that off for you then.
Take this off, please. Thank you.
Okay.
Just getting that
Fine.
off.
Even now, you're probably going to be fairly seized up. Haven't been sat in the collar for a little while. Okay.
Joanne's pain relief is taking effect. Dad Brian joins her alongside bed 9 back in the corridor.
Ow.
Lump of glass.
Ow. Oh, it's stuck in my head.
Got the glass?
Aye. Ow.
Yeah.
Ow.
Just a minute.
Oh, you got it. Ow. Oh.
Right, there's a chunk of glass.
Whoa, Jesus. Oh.
Piece of glass stuck in her head.
There's some more as well. I was saying I was hopefully going to be home in time for a cup of tea and watch Cora's, but I don't think that's good. I was going to say, I think that might be Coronation Street tomorrow night instead of tonight. But at least we're smiling.
Takes more than this for the knock Geordie's back.
As soon as Joanne's cuts have been cleaned, they can both leave A&E and bed 9. The emergency department at Newcastle's RVI is busy 24/7. Each bed sees up to 10 patients daily.
There's also some bruises there where it looks as if you might have been grappled a bit.
Running the emergency department is a bit like running a kitchen. Everything is time dependent. Everything has to be run through a head chef. If it doesn't work like that, the emergency department falls apart.
9 can, 8 can't.
She's not ready to go yet. She hasn't had any antibiotics or fluids.
He's too sick. Yeah. Okie dokie.
A&E bed 9 is ready for the next one.
Right, get you to hop onto this wizardry-looking bed.
19-year-old Ashley has come into hospital.
Is that too high for you?
He's passing large amounts of blood.
It's a bit high. Right, come on, have a seat up here.
He's also been vomiting and is in lots of pain.
So how can we help you today, then?
Ashley's being seen by Registrar Dr. Lung.
As soon as I got off the bus, I felt like I had an accident from the back.
Right,
So I went to the toilet and it was just all blood.
Right.
Like lots and lots of blood.
What colour was the blood?
Some was like really light red.
Yeah.
And then other times it was like dark.
Okay.
From then I've just been non-stop vomiting with the pain and everything else.
So the pain's kicked up a bit, is it?
Yeah.
Ashley recently had his appendix out. After the surgery, there were serious complications.
Problem is when I got discharged, like with the blood, and it was an infection thing in my stomach after I got it out, and I was in
the stomach or in the appendix?
In the appendix area.
Right, and you had bleeding with that as well, did you? So you've had quite a complicated appendix.
Yeah, I have.
And before that, you normally fit in well?
Well, a month before I got my appendix out, I got an emergency tonsillectomy.
You're still in a lot of emergency surgery, aren't you? You get no points for coming back, you know.
I know.
10% of adults in the UK will experience rectal bleeding. When serious, it's treated as a medical emergency. Since his appendix operation, Ashley has been taking medication to help with his pain.
No, it's just I'm on regular medication at the minute. I'm on morphine, tramadol, and regular paracetamol.
And you took all that and you're still in pain at the moment, are you?
Yeah.
And can I have a feel of this tummy?
Yeah.
Where is it most sore if you had to point to one spot?
Oh, yeah.
Just down there. Have we given you anything for pain relief yet? Just pop your hands down.
No, she tried to put a cannula in my arm, but she couldn't.
That's sore.
She couldn't get my veins.
Dr. Lung must establish whether Ashley's symptoms are a result of his previous surgery or something new.
That bit there. Just going to press a wee bit harder, love, all right? Big breath in for me. And all the way out.
She needs to do an internal examination.
Okay. Have you had one of these done before?
Yeah.
I'm just going to pop a wee finger up back. If it's really uncomfortable, let me know, all right? Right. There's no blood there at the moment that I can see. It could just be a one-off. Right. You need to do some blood tests, okay? So we'll get you going on some fluids. Take your watch off for me, love.
They normally have to get it through the side of my wrist before.
Oh, that's a cheery thought, isn't it?
Ashley needs fluids. Vomiting has left him dehydrated. Blood tests will detect any infection.
I've got a few tiny ones for us to play with. Okay? Just a lot of pain. I'm feeling this is probably blocked off. Where do we normally find anything on you? Is it your other arm?
Normally they get them in like.
Oh, you can't get them in there, can we?
That one's normally the best. Is
that the best one? Wiggle around this side.
Ashley's had trouble providing a blood sample before.
How many attempts last time?
About 8.
Oh no!
I had like little holes all over my arms because they tried like the same one a couple of times, and it was like, ow.
Ashley will stay with A&E bed 9 until the blood sample is taken. It will reveal if there's any serious infection. At Queen's Hospital in Romford, the labour ward is busy.
Yeah, I can't actually book the appointment, Nicky, but I can email them with the patient.
Staff are dealing with several emergencies.
we go. Lovely.
Maternity bed 7 is with Yona. She was scheduled to have a caesarean section because her baby is lying in a breech position. But she's already started contractions. Gas and air is helping to ease the pain.
I'm waiting. It's my baby, you know. I want to start the family, you know.
Yona and Liviu married a year ago. They moved to the UK to make a better life for themselves.
The baby is very happy for me.
You look at your
It's like
Yona has been waiting with maternity bed 7 for over 2 hours. Her contractions are getting stronger.
Oh. Oh. Okay, we're going to see it in 5 minutes, okay?
yeah, but she want to push.
The sensation to push is a sign that the birth is imminent.
Tell me, what do you feel like doing?
It's the sensation for the
You feel
push.
like pushing? Yeah. Oh, no. Give me a minute. Let me just take you back.
Hello.
How are you doing?
Obstetrician Dr. Robinson arrives to establish how far Yona's labour has progressed.
You have progressed in labour. You are about 8 centimetres dilated, so that's why the pains have got stronger and you're feeling the urges to push. I'm going to go and speak to the consultant and see what the safest way is to deliver your baby. But because you have progressed so quickly, it may not be safe to do a caesarean. We may end up delivering you vaginally in theatre.
A caesarean section is no longer an option for Yona. Maternity bed 7 takes her to theatre.
Can I have your clothes? You need to stay here so you come and get your
A team of midwives is on standby. They will assist in what is going to be a high-risk breech birth. In the heart of Newcastle sits the Great North Children's Hospital. It has its own A&E department with 9 special paediatric beds.
Obviously, if the patients need to come, the patients need to come. I haven't got any medical beds, do you know what I mean? So just whether it's bed or cubicle, if I'm going to put them on, you know, like ward 10 or 11 kind of thing.
The beds are the smallest in the hospital, designed to look after patients under 16 who need emergency treatment.
Breathe in.
Breathing in.
And out.
Pediatric bed 27's next patient is 11-year-old John. His mum Tina brought him in after he fell off his bike.
Swing your legs round. Okay, I'm Laura. I'm one of
He may have broken his arm.
Well, fine. Just stay there for a moment, all
Thank
right?
you.
No, is it John?
Yes.
Yes.
Nurse practitioner Rain gets the details of the accident.
Is this your mum that you brought with you today?
Yes.
Okay. Just give my hands a little wash and then we'll find out what's been happening with you. What's happened tonight?
I came off my bike, going downstairs.
And how many were you attempting to go down?
About 20.
About 20. And when did you come off?
Like the last one.
At the last one. So you'd gone down 19 and then you fell off at the last
And he
one.
had his cousin on the back.
Right. And how old's your cousin?
9.
9. And then when you fell off, did you go over to the side?
Nurse practitioner Rain checks to see if it's broken.
Can you make your elbows go nice and straight? Okay, and then can you bend them up? And then bend them back out. And then can you flip them over? And then back again. Brilliant. Let me just have a little peep at this arm. Okay. Now, any pain down in there? No. Any pain as we come up? Any there?
Not there.
Okay. What about there?
A little tingly.
A little tingly. Okay. And what about up there? No. Okay. And nothing there. Can you lift your foot up and touch Brilliant, and then back down to the bed, squash my hand in, so if you curl your toes up. Lovely.
With no broken bones, nurse practitioner Rain examines the deep lacerations on John's elbow.
I think your worst cut is up here, isn't
Yeah.
it? So if you just pop it out for me.
It's deep as well. It is, isn't it? We break off when I do it. Yeah. Are you a tough cookie?
So what I want to do, I want to give these a really good clean, especially that one, and then hopefully we can put a steri strip along there just to bring the edges back together. Is that all right?
Doesn't hurt.
Yeah.
I'm relieved that there's nothing broken. Just a good clean up, and we can get home and have some tea.
This is not the first time John's mum, Tina, has brought him to A&E.
He's always into mischief when he's outside playing on his bikes, falling off scooters, going to the skate park, banging his head. He's always got bruises up and down his body. He's a typical little boy.
I usually get hurt climbing trees and going to the skate park and all that. Where I split my hand up and it's got scars. That's when I was climbing the fence. I tried to grab the top but then I realised I had spikes on it.
Might need a stitch.
Hope I don't, because it'll sting even more and I don't like stitches.
Nurse Beattie arrives to clean the grit from John's cuts.
Should we start on this arm? That one looks alright, doesn't it? So you often give your cousin rides on the back of your bike, do you?
Sometimes.
Sometimes.
I don't usually let him.
Do you not normally go down the stairs with him on the back? No. I can't go down the stairs on my bike without anybody on the back anyway. Too scared. They're all pretty clean, to be honest. This one's got a bit of sock fluff.
A brand new socks.
Right, elbow.
Why not? Because it is hard.
She needs to make sure there's no glass or anything in.
Children suffer 2,000 injuries every year on their bikes.
I'm getting on now.
Alright, we're good.
Do you think you'll go down them again?
Yes.
Do you? Do you think you'll wear a helmet next time?
No.
You should wear a
I
helmet.
think you should.
You'll end up back on this bed, won't you?
Good.
It's not good.
It is, I like these beds.
If grit is left in the wound, it's likely to get infected and fail to heal.
Just pop your arm out straight for me again.
Nurse practitioner Rain wants to prepare the area with anaesthetic cream.
What we'll do, we'll put that magic cream on to make it go numb, and then we can give it a really good clean because you've got little dots of gravel in there.
You can see it, can't you?
Yeah, and it needs to come out. Is that okay?
Will I not feel a thing when?
No.
You'll just feel us rubbing.
So put a little bit of
Just
the
trying to
gel
get it
in
out.
the wound and then a little bit round and then cover it over and then it'll go nice and white and that's how we know it's numb.
Alright.
There you go. Just relax your arm down. That's it.
In 20 minutes, the wound will be numb. Until then, John will have to wait with Pediatric Bed 27 to find out if stitches are needed. At Newcastle's RVI, A&E Bed 9 is with 19-year-old Ashley. He was rushed into hospital following heavy blood loss. Registrar Dr. Lung has struggled to get a blood sample.
Should we have a look at the ultrasound before we stick any more holes in you?
She's having to use an ultrasound machine to find a suitable vein in Ashley's arm.
Can I just have a look at your other arm, see if that's any better? Just in case that one looks any better. Okay, the sharp scratch coming. Right, we found some blood, so which is good. No, you're not a zombie.
Ashley recently had his appendix taken out. the blood loss he's experiencing could be a sign of infection. A&E bed 9 takes him for an X-ray. The heavy bleeding could also be caused by a perforated bowel. The X-ray will also cover Ashley's chest and abdomen.
Can you just tell me your date of birth, please?
Dr. Lung is concerned about Ashley's extreme abdominal pain.
He's looking like he's going to have to come into hospital for a couple of days. So I think our priorities at the moment is to get him comfortable in terms of pain relief, make sure he's not got any ongoing infection. I think just due to his level of pain and his past medical history, a surgical review would be appropriate for him.
Okay, Ashley, deep breath in there.
A consultation with a surgeon will determine whether Ashley needs another operation.
Give him a call now before you take it.
Meanwhile, Nurse Burke has arrived at A&E bed 9 to give Ashley more pain relief.
Right, have you had morphine before?
Yeah.
But Ashley's condition is deteriorating.
You all right? You okay? No. Ashley? Ashley? Are you okay? Ashley? You okay? Are you alright? What's the matter? Ashley? What's the matter? Is it the pain? It's coming back.
A&E bed 9 takes Ashley back to the bay to be monitored.
You alright?
I just had a massive pain and do you know what happened?
Dr. Lung has made the decision to transfer Ashley to the surgical team.
Oh, hi, it's Becky on the A&E Regis. Can I refer you a patient, please? He's taken his own Oromorph tramadol and he's still in a lot of pain, so he's had some IV morphine from us. But I think given his past history and the amount of pain he's in, he's not going to escape, I think, without a surgical review plus minus admission.
Ashley leaves A&E bed 9 for a bed in the observation unit, where he'll be seen by a surgeon.
This one's much better, yeah, it's more comfier than the one round the corner.
A&E bed 9 is free for the next emergency patient.
Yeah, I feel like I'll be alright, yeah.
Across at the Great North Children's Hospital,
Hello, PTNA. Hello, PTD, Becky speaking.
the Pediatric Emergency Department is also busy.
Has he been coming in regularly for some blood tests, has he? Or...
A&E bed 27 and 11-year-old John have been together for just over an hour. He's had an accident and fallen off his bike. The wound, which is filled with gravel, may need stitches.
Not getting stitches. Needles going from me arm and then I'm punching him.
Nurses have tried to clean the wound, but the pain was too much for John.
You ready for us to try again?
Yes.
Yeah?
Anaesthetic cream was applied 45 minutes ago. Nurse Beattie will try again.
You scared?
Yes. Why is it waiting?
Because it'll have gone a bit numb. Thank you.
Don't look. I still feel it. Don't kick the nurse. His legs are going on.
Yeah, I don't want an injury as well.
Squeeze my hand.
Good lad.
I'll squeeze me. Don't want to break your hand.
The wound has to be cleaned in case John needs stitches.
They're really stuck in there.
I'm still. Kiss your hand.
Getting the bits out, don't worry. They're coming.
Hurry up.
I'm trying.
Hurry up.
Trying. Oh, got some more.
Yes.
Maybe swap places. We'll have your mum on bed.
Yeah. I'm not holding his hand anymore. Looks just all like black and dirty and ugly and disgusting.
There's one piece of grit that Nurse Beattie is struggling to remove.
Just can't get that last bit of gravel out the back.
I'll just leave it.
You can't just leave it.
Are you happy for me to have another little poke? I think we've got it. Good?
Is that it out?
I think we've got it. Yeah?
Yes.
Looks like it's gone, doesn't it?
Yes.
Now whether we can get that together.
If John's large cut can't be closed with steri-strips, he will need stitches.
I don't know whether we're going to get that together.
Will it not just heal?
No, it's deep.
Oh.
Right. I need you to keep your arm straight for me. No.
Sorry. Will I need stitches?
I think what we should do is ask Louise to come back and have another look. I just don't think the steri-strips are going to stick. So I couldn't get the wound together just with the small steri-strips. They wouldn't stick and the wound wouldn't come together. I don't know if you can come and have a quick look and see what you can do.
Yeah, no, I'll have a little look.
Hello, Puppet. Can I have a look at this as well? Yeah? Let me just have a little peep, see how clean it is. That's perfect. Let me see what we can do.
I don't want stitches.
You don't? So if you pop your arm out for me.
Nurse practitioner Rain attempts to bind the wound with a longer steri-strip.
How does that feel? Okay. I'm just going to put another one on.
Can I have a look? Oh, yes.
Are you all right? Yes. You've been super brave today. So these need to stay on for 5 days and they need to stay clean and dry in that time, okay?
John didn't want stitches, but he would like something else.
I got a bandage.
I'll put you a nice dressing on, maybe.
You're desperate for a bandage, aren't you?
Let's have a little look. I think it'd probably be better if we leave that open rather than putting a dressing on.
Right. Oh, I want a bandage.
A big bandage.
You don't need a bandage.
Come on, then we can go home.
John and his mum head home. Pediatric bed 9 is cleaned and prepped, ready for its next patient. It's midnight at Queen's Hospital, Romford, and there's an emergency. 30-year-old Yona has been rushed to theatre on maternity bed 7.
Just going to clean you and check where the baby is that okay? Oh!
Yona was scheduled to have a caesarean to deliver her breech baby. But now she's gone into labour naturally. It's progressed too far for surgery or an epidural for pain relief.
Just stay here, make sure that she stays on the table and doesn't fall off. Deep breath in and out. A bit more in the middle, okay, because you're on the slant here. That's it. We're going to get your husband in, okay?
Dr. Noyne is the anaesthetist dealing with this emergency delivery.
The plan was to do a caesarean section.
Yeah.
Okay. The caesarean section doesn't make any point because the baby is too low down.
Yeah.
So in that case, I can't do a spinal anaesthetic because with the spinal anaesthetic, she can't push as hard to get the baby out.
Alright, I don't think the baby's coming, so let's see if we can deliver your baby. Can you give them that gas? The baby's coming now, okay? Alright, Iona, you're doing so well. I know you're in a lot of pain, but it's too late now for the epidural because the baby's just there. Yeah? Is that better?
A 10-strong team of doctors, midwives and other theatre staff are working together to try and deliver the baby safely.
It's a very high-intensity situation. There's a lot of things that can go terribly wrong. Any movement of the mom can be dangerous.
Is the bed still fresh? Oh, no! Oh!
Iona, look at me, okay? With the pain, I want you to push.
Push all the way down, nowhere else.
3% of all births are breech. Most aren't delivered naturally.
This will soon be over. There you go. Deep breath in and out.
Ayana, push into your bottom.
And push. Push, like you've never pushed before. Go on.
She's mommy, they tried to turn baby already. So it was not successful.
30 minutes after being brought to theatre, Yona gives birth.
Good job, you two. Congratulations.
It's a healthy baby girl.
Baby, ti credi? Ti credi? Da come sfinito.
Is that your first baby?
Yeah. Wow.
Well, well done, congratulations.
Over 3 hours after arriving on maternity bed 7, Yona and Liviu are with their new baby daughter, Chloe.
No, it's okay.
Is it okay if I put you on a monitor?
Congrats, you two. You've been great.
Thank you very much. I'm good, I'm happy. Now we're absolutely perfect. The baby is good. My wife is okay, you know. We're together, for family. It's perfect.
Our hospital beds have given us intimate access to the work of the NHS. After a short stay on paediatric bed 27, John's wounds have healed and he's back doing stunts on his bike. Ashley was treated for a serious infection and spent 5 days in hospital. It's now cleared up. Since the car accident, Joanne and Brian have tracked down the driver who helped them to say thank you. And after a high-risk delivery, baby Chloe is doing well. The beds are now back on their wards, ready and waiting for their next round of patients.